Assalamualaikum everyone, we are from Group 2 from TSP8. Today we are presenting pancreas transplantation. Pancreas transplant is a surgical procedure in which a diseased pancreas is replaced with a healthy one from a donor. This procedure may be an option for certain individuals with a type 1 diabetes. Type 1 diabetes is an autoimmune condition where the pancreas is no longer able to produce insulin.
Pancreas is one of major role in our body. While losing it can be a problem to our body, one of the problems is our digestive system will be disrupted as pancreas cannot produce enzyme causing the food not properly digested that will promote to diarrhea, fatty stool, weight loss and malnutrition. Losing it in fact can also cause blood sugar problem in our body, which insulin production will be interrupted, leading to diabetes mellitus. The symptoms are frequent urination, excessive thirst and fatigue. And other effects of losing pancreas function are weak body and low energy, vitamin deficiencies, and poor immunity and healing.
Now, let's look at the anatomy of the pancreas. The pancreas is a soft elongated gland located in the upper abdomen, behind the stomach, and near the spleen. It is connected to the digestive system through ducts, which allow it to release substances into the small intestine. Next, we move on to the physiology of the pancreas, which involves both exocrine and endocrine functions. For the exocrine function, the pancreas produces pancreatic juice that is released into the duodenum. This juice contains important digestive enzymes such as amylase to break down carbohydrates, lipase to digest fats, and protease to break down proteins. For the endocrine functions, the pancreas contains specialized cells, which are alpha cell, which secrete glucagon, beta cell, which secrete insulin, delta cell, which secrete somatostatin. These hormones are important for regulating blood sugar level. Next, I'll be talking about the importance in maintaining homeostasis. The pancreas plays a key role in maintaining homeostasis, especially in two main areas. First, blood glucose regulation. The pancreas helps keep blood sugar levels within a normal range using a negative feedback mechanism. When blood glucose is high, insulin is released to lower it. When blood glucose is low, glucagon is released to increase it. Next, digestive homeostasis. The pancreas also ensures efficient digestion by first, helping break down food effectively. Secondly, maintaining the optimal pH in the small intestine for enzyme activity.
Next, I will explain the transplant procedure. First, patients with type 1 diabetes mellitus undergo pre-transplant evaluation such as blood group, HLA, and glucose level to ensure compatibility. Then, the donor pancreas is obtained from a deceased donor and preserved in a cooked solution. During surgery, the pancreas is placed in the lower abdomen. The blood vessels are connected, where the artery is connected to an artery and the vein to a vein to ensure proper blood flow. The donor duodenum is also connected to the intestine or bladder. The original pancreas is usually left in place, and after surgery, the patient requires monitoring and lifelong immunosuppressive treatment. After the transplant, the body starts to adapt. The immune system may recognize the organ as foreign, so immunosuppressive drugs are needed to prevent rejection. The transplanted pancreas produces insulin, which helps control blood glucose levels. It also produces enzymes that improve digestion and nutrient absorption. Finally, the body gradually adapts to the new organ, but lifelong medication is still required.
Okay, so we will move on to Islamic view on pancreas. In Islam, organ transplantation is viewed through the lens of Maqasid al-Shari'ah, the objective of Islamic law, specifically the preservation of life, hifz al-naf. The general ruling is permissible, which is harus. Medical treatments, including complex surgeries like a pancreas transplant, are permissible based on the Shari'ah maxim. Necessity overrides prohibition, al-darurah to be al-mahzurat. from the Quran, and whoever saved a life, it is as though he had saved the life of all mankind. Surah Al-Ma'idah, Ayah 32. And from the Hadith, make use of medical treatment, for Allah has not made a disease without appointing a remedy for it, with the exception of one disease, namely old age. Sunan Abi Dawud.
In conclusion, pancreas transplantation is a valuable treatment option for individuals with a type 1 diabetes mellitus, as it helps regulate blood glucose levels and enhance overall quality of life. In general, pancreas transplantation is a promising approach to achieving stable homeostasis, especially when other treatments are no longer effective.
I just had to let you know you're